Good morning. I'll call the Kansas County Health and Human Services Committee to order. And our first order of business is to approve the minutes of the last meeting. And just as a sort of a note, only 2 of the 5 of us were at that meeting. So
Also move.
if you move it, I will second it. Any questions or comments? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Thank you. Well, before I get started, I should just welcome everybody to be here and anybody who might be watching. And I will use a little executive authority that I did when I was chair and ask everybody to turn their cell phones off. And I will ask that if a cell phone rings during the meeting, that you will ask you, not require you, but ask you to make a $20 donation to Kansas County Food Shelf or the link for having your phone go off during the meeting. So we had a little fun with that a few years ago. I thought we'd do it again. Now moving on. Pardon me? I think we got you one time. Thank you. Now we have the bills to pay.
I'll move the bills.
Raleigh moves the bills.
I'll second it.
Commissioner Anderson seconds. Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. And we do have some warrants that we need to act on. So I would entertain a motion to accept a cancellation of warrants.
I would so move.
Commissioner Gardner moves. Do I hear a second?
I'll second.
Commissioner Nissen seconds. Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. So we have a number of contracts and agreements and policy discussions today. The first item of business is the acceptance of a donation. Jenny?
Thank you. So we received a very gracious donation that I want to present before you. This is on behalf of Pastor Steve Verhelst at the Church of St. Mary's. So the Catholic Area Faith Community of Jesus of Our Living Water, that group is made up of the Church of St. Mary, located in Wilmer, Our Lady of the Lakes Church in Spicer, and then the Church of St. Clara in Clara City. They have enclosed a check in the amount of $1,500. They want these funds to support children in placement and the children that are in need of money at our discretion. So I would ask your approval of this donation.
You've heard Ms. Libert's request. I'd entertain a motion for acceptance of this donation.
I will make that motion.
Commissioner Nissen makes a motion.
I'll second.
Commissioner Burke seconds. Any discussion?
Yes, I would like to comment. I wish all our resolutions were like this. That is really awesome that they could do that. That's
Yes,
great.
we're very thankful. Yep. And the children will be.
On behalf of the board, I wish to thank the church for that donation. It will be put to good use. All in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Motion carries. I think we'll go to the Woodland Center. I should check these off as I'm doing them. Woodland Center Children and Adult Crisis Grant Contract. Corinne?
Good morning, gentlemen.
Morning.
Just to
Morning.
introduce myself, I am Corinne Torkelson. I'm one of the social service supervisors with Kansas County Health and Human Services. Part of what I supervise is adult mental health and children's mental health programs. What I have for you today is that back in November, we had accepted the award, a grant award from the state for the mobile crisis. Mobile crisis is for adults and children, and it covers a 24/7, 365 days a year. And once we accepted that grant, we were awarded that grant, and then what we do is we contract out for Woodland Center to provide that service. So the contract that we have today is a contract for Woodlands to be able to provide the service for mobile crisis. The total amount, this is a 2-year contract. The total amount is $1,325,000. It is split into 2 years. The first year, 2021, is $625,000, and then the second year, the 2022, is a $700,000, which adds up to the 1.3 million. And again, this is money that we received from the state, a grant we received from the state, and we're able to contract that out with Woodland to provide the service.
And just for those who may not be completely familiar with it, what is the mobile crisis?
What the mobile crisis team does is the ability for anyone who is finding themselves to be in a mental health crisis, they're able to make a phone call, and then there is mental health practitioners and mental health professionals who respond then to that call. So initial comes in as a call, and then depending upon what's described, what the situation is, then they can send people out to that call, out to that site. That might be in someone's home, it might be at a school, it might be in ER, it might be at the jail. So it's a wide variety of situations that they can get into, and the concept of it is to be able to be mobile, to be able to go out, meet with that person, sort through what that crisis may be, and then make recommendations based on what's going on. They might be something that once they spend some time with that person, they've been able to resolve what's going on for that person and support them through that situation. It may, if need be, it may be a referral to their crisis center, where they're bringing that person into the crisis center because the safety is an issue. It may be a situation where maybe they need to call law enforcement. They're concerned about some real risk, and so law enforcement may or may not get involved. If it's a suicidal sort of situation, then taking them to ER in order to meet the requirements of trying to get them on the mental health unit, those sort of things. And one of the nice things about mobile is that it's truly, obviously, one of the hopes is for it to be an early intervention sort of a concept. So people are trying to get ahead of that and making a call when they're feeling some of those struggles, and that ability to be able to reach out to somebody. And now there is someone 24/7 who's going to be able to respond to that. I can't think now off the top of my head, and I believe Woodlands has been providing mobile crisis for, I believe this is a 4th year. Also, this contract, Woodlands covers 5 counties, and so this contract is to cover all 5 counties for mobile crisis. So Woodland provides that across those 5 counties. And so it's really, and what they've been able to add in the last couple of years is what's called stabilization. So if they went out today to respond to somebody, then this stabilization allows them to check back in with that person and follow that person for I believe it's up to 15 days they're able to respond or follow that person. Some of that follow is about, maybe it's helping them get an appointment set up with a therapist. Maybe it's helping them seek out other services that they might need, if it's housing, if it's food support, whatever that might be. But that ability to follow with them so as to make sure it's not just a out and drop kind of a deal.
Yeah, and thank you for that explanation, and it's seems obvious that, especially for the further out counties, it's kind of an impediment to drive to Wilmer and seek that help, and so they may not seek it if that's what they had to do. So,
right, and one of the things that Woodland is really working hard at is to be able to have staff across the counties. So it's not just everybody's coming from Wilmer to go out to Big Stone, for example. It's just being able to. That was a bad example because Big Stone isn't in one of the counties, but being able to try to have staff across all of the 5 counties.
thank you. And that background distracted me. Do we have a motion? We do have a motion, or you're making the I can't remember where we're at.
Well, I will make the motion
Okay,
to
Commissioner Gardner makes a
approve the
motion to
contract.
accept the contract. Do I hear a second? I will second it. Any discussion? Any questions?
Can we ask a couple questions?
Sure,
New
absolutely.
guy. You said 5 counties. Which
I
counties are
think
they?
the 5 is,
Yeah. Renville,
it's Renville, Meeker,
Chippewa,
I should know this, I'm so sorry.
Swift, yeah.
Swift,
Lackaparra,
Lacaparle,
and Chippewa, maybe.
and Chippewa.
Okay, all right. And then the increase, do you think that's largely due because of the last year and the lockdowns and stuff with people, or is that nothing to do with that, or?
I think the increase comes with, the mobile crisis is a requirement for every county to have a mobile crisis situation. And I think through initially, the funding was based on who wanted to do it. And then what happened is that they decided that every county needed to do it, but they didn't necessarily increase any funding. And so what's happened through the last few years is they legislatively then been able to give some more funding to help support on this. This amount is really substantially under what we initially had asked for because of what we truly need in order to do this well. But I think that increase is just the state trying to slowly being able to build up to what's needed across the state, not just for ours. I don't know if that answered your question or not.
Yeah, a little bit. I mean, maybe I'll have more questions, but I'm good for now, but
Okay.
thank you.
Commissioner Gardner.
I want to thank you for bringing this forward. I'm somewhat familiar with the program. I have an in-law who works out in the western part of that service area under this program. And from everything that I know and from what I've learned over the past number of years, there's folks just crying out, especially during the pandemic, for these services, and having that mobile crisis unit has literally been a lifesaver.
Yeah.
So.
And I think, and Matt maybe goes back to a little bit more about your question about the last year and the pandemic and how some of that is playing into that. And we're obviously seeing an increase in the number of calls they're seeing. We're at the county, we're seeing an increase in our cases, but also mobile crisis is seeing that increase in those calls. And so I don't know if that helps in some of that. We're definitely seeing that increase, and it's being utilized more often. And so that funding is based on that utilization as well, kind of the formula, if you will, about that.
All right.
All right. Any other questions or comments? Hearing none, all in favor of the approving the contract, signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Thank you.
All right, thank you.
Next up, Stephanie Louise
Lightsey?
Lightsey, thank you.
This is the password.
Okay.
Thank you.
Welcome.
Thank you. Give me 1 second here.
Come on.
Here we go. So this morning I am here. I'm Stephanie Lightsey. I work with public health, and I'm one of the family home visiting nurses. And over the past 3 years, we've had a grant that we have been working with. It's called the MEPSP grant. It's short for Minnesota Expectant and Parenting Student Program. And the grant officially ended this summer. And so I was just here to share kind of a recap of this program with you. So this federal grant was awarded to Minnesota, and it was one of the 5 states that received the funding for 3 years. And you can see it started in 2017 and it finished up in June of 2020. Because of COVID, we did have what we call a no-cost extension that was granted for the months of June, or for July and August of this year. And that just meant that we were allotted a couple more months to use our funds, as some of the things that we had our monies dedicated to were either canceled or not able to be utilized in how we originally thought that they were going to be. In the state of Minnesota, there were 3 sites that were awarded this grant. There was one up in Bemidji, one in more of the metro area with Hennepin County, and then also ours with Candy, Ohio, and Renville County community. The goal of this MEPSP program was to address the health and education outcomes of expectant and parenting teens, women, fathers, and their families by providing life-affirming support services that they need to be physically and emotionally healthy. It was also to help improve their parenting skills, strengthen relationships, but also to help them in completing their education goals and fulfilling some employment. So we had 3 areas that we focused on: education, health, and then their parenting and life skills. With education, there were a lot of times that some of these participants really didn't even know that education was an option for them. Nobody had ever brought that up to them or maybe encouraged them to look into that further. So we would do things like career and lifestyle vision, kind of asking them, where do they see themselves in 5 years? You know, what is happiness to you? How will you provide for your family? Things like that. And then we would start setting goals, both short-term and long-term. We would also help them by looking and identifying barriers that might be holding them back from their educational goals. And then once we would get them in the program, we would celebrate the accomplishments, whether they're small or large. We also would support their health, and not just their personal health, but also their child's health. So it's kind of the holistic picture: mental and behavioral health, social emotional well-being, and also their physical health. And for the child, it was making sure that they were getting their well child checkups, their routine screenings, maybe nutrition counseling, and then getting them enrolled into like early childhood Head Start or child care services. We have the ability, so between Candy, Ohio, and Renville County, the nurses are trained in the program called Growing Great Kids, and we use that curriculum to help with the parenting and life skills. So Growing Great Kids focuses on from prenatal to 3 years old, and it tells you what it covers: basic care, social emotional, cues and communication, physical and brain development, and play and stimulation. But we also focus on the Growing Great Families part too. So we're looking at the relationships between parent and child, and also between the other family members. It also talks about, there's curriculum that we talk about reducing stress, how to communicate effectively, and then also problem solving and discipline. We did support those participants with concrete supports, so referring them to resources that they need, whether it's transportation, food and housing, or other benefits like health insurance. One of the unique portions of this grant was that we were allowed to use the funds to give our participants the concrete supports in a form of a Walmart gift card. So once they met with the nurse, we were able to give them a $40 gift card for them to use. And that gift card was used for the clients and their children, whether it was for food, clothing, diapers, educational toys and books, or a computer. So our main focus was our in-home visits, and it was 1 to 2 times a month that we would meet with our participants. And there was a total of 13 case managers between Candy, Ohio County, Renville County, and also the supporting hands nurse family partnership nurses that are in Candy, Ohio, and Renville County. And we had the capacity to serve 50 participants. We did some data collection during this time, and that was just to reflect our accomplishments and our accountability to those that we received the grant from, and also for continuous quality improvement. We did a couple QI projects. Every 6 months, there's a student-parent experience survey, and the last one that was done in the fall of 2019 that we have the results or the data from said that 90% of the participants reported that they were very satisfied with this program. Some of their comments were It got them motivated to achieve their goals and understanding what they needed to do to get it done, helped them focus on a single goal instead of looking at a lot of goals. They talked about time management skills and getting me thinking about other things I would like to do besides being a mom, and gets me motivated. We had, like I said, we had a maximum of 50 participants. Our average in the year of 2019 was 42 participants per month. And in 2020, we were averaging about 45 participants a month. And you can kind of see from January to December, all of the nurses combined made 785 visits. And from January to August, there was 559 visits. Obviously, when COVID came into the picture, we had to make some changes. So we did have to change our visit format. We were doing phone calls or like video chats. The grant was gracious enough to allow us a little bit of leniency on the time of the length of the visit. We were supposed to have them meet for at least an hour to qualify for the gift card, but they did allow that to go down to between like a half hour, 45 minutes. And we still continued with the 1 to 2 visits a month. And the concrete supports did continue. So the gift cards did continue during this time, which we did notice that this was probably the time that these clients needed it the most. Some of the effects of COVID-19, so we had 2 groups. We had ones that were like, this was very negative for them, and others that was positive. So some of the negative that we heard was that one had to quit school because they were health-wise falling into a high-risk category. Some lost their job. Some had difficulty transitioning from distance learning or to distance learning. A lot of the community-based education programs were canceled or suspended. Some people did not have the technology to facilitate distance learning. And also some of them, especially those who are English as a second language, had difficulty with the technology. But then we had others that were like, no, this has been a good thing because it's forced me to spend more time. I have more time to focus on my studies. I can work at an accelerated pace. I'm at home more with my kids and my family, and they're reporting an increased focus on their schoolwork. So overall, the MEPS program has given us, as far as ways to continue these kinds of goals, is that any of our participants, education should be an option for any of those. So that is something that we're going to incorporate into our home visiting program, have that talk with them, give them the inspiration to maybe potentially look at furthering their education. And another big one was goal setting skills. A lot of the participants that we've worked with just don't have that knowledge. And so we did work quite a bit with some participants in learning how to make goals, and so that they aren't overwhelmed, and just, accomplishing one goal at a time is all it takes to get to your larger goal. And that is there any questions or comments?
Thank you. This is an informational piece. There's no
Right.
request for contracts or anything, agreements, so
Correct.
if you have questions,
I do.
Commissioner Nissen?
Curious, how do you define who gets these services? You got 50 in 2 counties. You got to be missing a lot of people, I would think, that are having babies.
So the grant was focused specifically on parents who were looking to further their education, so if they were enrolled in school, things like that. And there was a certain age group that it was from like 14 to 23. And it was a voluntary thing, so there were people that we did approach them to be in the program, and they may have declined. Overall, there were, over the span of time of the 3 years, over 100 different participants that were enrolled at one time or another.
Did you, was this marketed at all, or were you just waiting for people to come and ask you?
So we
these
had,
services?
we had some of our community partners. So we have, let people like Hope Pregnancy, the Alternative Learning Center know about those things too. So we were kind of Bridgewater College knew about our program and things like that. So sometimes we would get referrals from outside, but a lot of the referrals were from inside our agencies.
Thank you.
Thank you. And thank you very much for joining us today and providing that information. All right, next up, I don't know who's going to lead this discussion, but we have a proposed county tobacco licensing ordinance. So Ann Tepfer, Chris Wenich, or Michaela Holm.
Well, good morning, everybody. I'm
morning.
Annie Tepfer, and I am the Kansas County Drug-Free Communities Coalition Coordinator. And as you can see, I hope, do you guys have access to your tobacco ordinance? Okay, great. So we're happy to be here today to bring this forward to the board. About 6 months ago, we put together a tobacco committee to open up and look at our tobacco ordinance because there's legal changes that have to be made, especially since the legislation passed the Tobacco 21 laws. And so there was quite a few, and I think in the cover letter that I sent, I don't know that we need to go through all of those, but those are all reflected in the new tobacco ordinance. So our tobacco committee was made up of Jody Ammerman from Public Health, Chris Wenish, Michaela Holm from SHIP. We had Val Swanson, who sits on the coalition, that is interested in working on this work. Steve Alman from the commissioner worked on it with us. Rachel Molesbury from Assistant County Attorney. And of course, we included Public Health Law, Rachel Callanan, who is a senior legal advisor. They were wonderful to work with. And this is what they do full-time across Minnesota and across our nation, is to help people update their tobacco ordinances. And so, as you can see, the tobacco ordinance was first adopted in Kansas County back in 1997, after the Youth Access Bill was passed in legislation to regulate retail tobacco sales, so that it had to be licensed. And so then you had to also have compliance checks, because the whole bill was designed around reducing access of tobacco products to youth. That's what the real goal of this is. And that's what our goal here in Kansas County is too, is to reduce the access of tobacco products to our young people who are tempted and experiment. And we know that like 95% of adult tobacco users started before they were age 18. And so now the changes have increased that to age 21. We want to keep that tobacco out of the kids' hands until then. So as you can see, the tobacco ordinance, it looks like there was a lot of changes, but actually it's a lot of restructuring. So they restructured it to include facts and findings and purpose. And as you can see, the comments in the side, that this would provide the evidentiary basis for proposed commercial tobacco control policies, basically. So we thought that was very strong language that would support why we are having the tobacco ordinance changes, and what our intent is with this tobacco ordinance. The definitions section is really important here too, so that there's no misunderstanding of what each of these terms means. I would like to point out to you the licensed products. That would be on the second page at the top of the definitions. This was a umbrella term that is used in the rest of the ordinance so that it defines any tobacco-related device. So we don't have to name every single type of tobacco product out there, because it's changing, right? It's continually changing. We're getting new products all the time that are being licensed to sell nicotine delivery devices especially. So licensed products will be used throughout the rest of the tobacco ordinance, and it cuts out a lot of explanation from section to section. I was going to say, Chris and Michaela, anything you have to add to this, please jump in here. So obviously, we had to go through and put in all of the legal changes around Tobacco 21. But then beyond that, I think we wanted to highlight, if you would go into section 5, the license fee. So the license fee is set by the county board. It has been $200, but I don't know, Chris, what is the history on that?
I'm Chris Wenish, by the way. I'm the environmental health specialist for Kansas County Public Health. So I do the tobacco compliance checks for the county and manage this ordinance. So in the past, with our current ordinance that we have a $200 license fee in the actual ordinance. So what we're proposing to do with this amendment is actually remove that fee out of the ordinance and just leave it up to the county board to determine as changes need, rather than having to open up the ordinance for a fee change. The county, similar to what we do with our food, pools, and lodging ordinance. So anytime we want to increase that fee or change it, we can just go to the county board and do that, rather than having to open up the entire ordinance for that.
Yeah, thank you, Chris. Yeah, so that makes it understandable. And the fees, really are supposed to bring in revenue for the administration of the licenses and the compliance checks. So you should consider that, I guess, when you're making the fee, what that would be, just so it's sufficient to cover all those costs. Next would be, I would like to look at, if you have any questions, please just ask if there's anything in the ordinance as we go through it that you're not clear on. Yes.
Mr. Chair,
Yes.
just to be clear, the last piece is probably the only piece so far that has not been aligned in with state ordinance and policies?
I think so, yeah. Yeah, I think so. Don't you guys think? Yeah,
Okay.
yep.
And I would, if I may interject at this point, we're not going to be making a decision on this today. There will be a public hearing on this ordinance, as all ordinances require. So you'll have an opportunity to study this further before that public hearing. And we have the same right to ask questions at that hearing as the public does, so.
Right, yes, please do. The next section I would like to go over is 7A5. And I think this might be your section too, I think. If you want to talk about, Chris, about by means of delivery sales, all sales of licensed products must be conducted in person in a licensed retail establishment in over-the-counter sales transactions. So I don't know if you can describe that a little bit better too.
Yeah, so this would be something that we're interested in adding above and beyond what the state statute had. So basically what this would mean is that any establishment that sells tobacco, they would not be allowed to deliver those products. And that's just because of the difficulties in enforcing the age of 21 and stuff. If you have deliveries, that's a lot harder for our agency to enforce if they're delivering to homes and stuff like that. So any tobacco sales would have to be done at the storefront rather than delivery.
Yeah, thanks. Thank you, Chris. The next section would be 8B1. Okay, this page. So, and this isn't, there's a few changes in here. This does reflect the changes. I thought, you might wonder why it has changed so much. But the license, this would be administrative penalties for not passing a compliance check. And so fine used to be $75 here in Kennewick County. The state is now raised it to $300. And I don't think that's out of line. I know Renville County is $400 for your first administrative fine for not passing a compliance check. The second violation within that 36 months goes from $200 to $600. So they are putting the fine on administration, on the people that receive the license, who are actually selling the products to the public, making sure that they ID people, and the compliance check then goes in. Chris goes in with that and checks and makes sure that with a minor, who is now going to be 17 to 20-year-olds, to go in and see if they are able to purchase tobacco, if they're not asked for their ID or they don't know how to read an ID correctly. So that hopefully will get their attention and make sure that their employees are trained and that they know that they have to ID everybody that comes in the store that looks under 30, I think the law says now. Which is hard to do for a 16-year-old sometimes, because they're young, they're a clerk, but that makes the responsibility back to the owner or the manager to make sure their employees are trained and doing their job right. And then the third violation, it was 36 months, and I think we decided, had talked about raising that to 48, right?
Yeah, so in our current ordinance, that third violation, we look back 36 months and we want to increase that period to 48 months. So that's really only affecting the establishments that have an habitual problem of selling to people. So, anybody that, establishment that makes a mistake, accidentally sells, they have a teenager that sells one time, it's not going to affect them. And these are for the establishments that year after year, they're selling to minors. So we wanted to extend that out to 48. And in our county, our facilities have done a really good job of not selling to minors in the past. Typically, we only have maybe 1 or 2 sales a year to minors, which I think is really good. We have about 30, it bounces between about 34, 36 licensed tobacco sales establishments in our county. So 1 or 2 sales in a year is not too bad. But we have had in the past a couple businesses that have sold time after time, and this has kind of helped put an end to that by extending that period out a little longer.
So I think, as you can see down below, on number 2, so the employees or the clerks who would fail a compliance check would then have a penalty of $50. So they are putting the responsibility greatly on the owners, managers of those stores. And as you can see below that too, administrative penalties may be modified from time to time by the county board here, just by simple resolution. Are there any questions on those? Is that pretty clear?
Could I ask a question, Mr.
Yes.
Chairman?
Yeah.
Yeah, I was wondering then, maybe you said this earlier and I missed it, but these penalties and stuff, are they in line with like surrounding counties or are
The
they
penalties
way different
are in line with state law.
with state law? Okay.
So these changes
These
with
are
the
all
penalties
state.
are all what the Minnesota legislation passed
Okay.
that we
I
have
think
to
you said that,
follow.
Yeah, and I'm,
Yeah, no, that's
wasn't
why
sure
I
if it
brought it
followed
up,
with
because
all
it's
them,
a
so.
big change.
okay.
It's a big change right in
All
that
right, 'cause
section.
what I was thinking, if we were out of line with other counties and areas, it would get really confusing for businesses.
Right, right. And that's why the other counties, everybody's having to update their tobacco ordinances. And you can go higher if you want to have a higher fine. You just can't go below what the state has already passed. So it has to be at least $300. If you think it would be more beneficial or a stronger ordinance to go higher, you can do that.
Commissioner Nissen?
She just answered it.
Oh,
So in the interest of time, I think we're going to study the documents, look for the public hearing, and thank you very much for the updates.
You're welcome.
I think one of the things we're going to have to, you probably already have, if the legislature ever passed legislation legalizing recreational marijuana, it would be something that would probably be affected by this ordinance, because it is well, I don't know if it would fall under the tobacco definition, but something to.
we
about.
know that
I'm sure you are.
a lot of marijuana is also vaped through these vaping devices as well. So,
Thank you again.
You're welcome.
Thank you.
Ms. Lipper, you're going to give us a update on the COVID vaccines or COVID situation in general.
All right, good morning.
Morning.
So as you all are aware, via the news and just local press that I've put out, there's been a lot of changes in the COVID-19 vaccination distribution. So I'm going to go through a couple changes here with you. Last week, Governor Walz announced that the COVID-19 vaccine would be made available to those over the age of 65. Also, that included individuals that work at the schools, so teachers, and then those that work in some type of childcare setting. The Minnesota Department of Health has notified us at Local Public Health that we need to finish out our 1A priority group before we can look at this next phased group of individuals. So we still in Candy, Ojai County are working on our 1A group, and I'll go through the groups in the upcoming slides, but we still have approximately 3,000 individuals that remain in our county to be vaccinated in this 1A priority group. So here's the phase 1A, priority 1, that included any hospital personnel, ICUs, those are done in our county. Priority group 2, those will be finalized this week. That included assisted living facilities and those who worked in those type of settings along with other healthcare workers. And now we're into that priority group 3. This is a large group of individuals in our county. We have a lot of people that work in these settings that make up how our county is coordinated. So just to give you a little background on how the vaccine is distributed, so the federal government determines how many doses Minnesota will receive each week. Then Minnesota tells each region of the state how many doses they will receive. I can't tell you the number of surveys that we've had to get to the Minnesota Department of Health just as to what our current situation is. How many vaccines have we received? How many people do we have left in the priority groups? Oftentimes we get notification on a Thursday and we have to get a large survey done and submitted back to the state by Sunday or Monday. And then that's how they determine the different regions and pockets of the state that need more vaccine. Again, Minnesota coordinates with each provider, and then the vaccine is sent out through the national supply chain and it goes directly to providers. So it's not going to some facility at the state and sitting there, it goes directly to the providers. And then Minnesota allocates the doses based on federal guidance. So partners for distribution, we at Local Public Health and all the other local public health agencies across the state, we are a provider of the vaccine. We are receiving the Moderna vaccine. Local healthcare systems, so in Candy, Ojai County, that would be Caris Health. They are a provider in our county. They have the ability for ultra cold storage, so we have capacity to have the Pfizer vaccine here in our community through Caris Health, and then they also have received some Moderna vaccine. And then pharmacies. So the state has that pharmacy partnership program. You might hear it called as the PPP program, and the pharmacies have assisted with the distribution of the Moderna vaccine. So I know my graph is small, but you can see there's 385 providers in the state of Minnesota. A majority of those are made up of hospitals, then the pharmacy programs, local public health, and then there's some different primary care and tribal health. So you can see from the state, the distribution, we've received a quite more amount of the Pfizer vaccine than the Moderna vaccine, but total we've had, my sheet's so small, 109,100 doses that have shipped directly from the CDC going to long-term care facilities through the vaccination program, and then a total of 407,575 doses throughout the state. And anybody can get this data. The state just did the dashboard last week, I think. So anyone can go under the MDH website and go under vaccine and find these data points, and they change, I want to say, daily. So again, breakdown of how many vaccines have been administered. So throughout the whole entire state, 232,952 doses have been administered. You can see, again, quite a bit more Pfizer vaccine than the Moderna. And then it shows on the bottom, a majority of these have been distributed through the healthcare hospital systems, a little bit with the pharmacy, but you can see right here, only 19,000 have been distributed from local public health, and that would be all 87 public healths throughout the state of Minnesota. So last week, Commissioner Malcolm and Chris Erzman said that the new CDC guidance on the vaccine distribution means millions more Minnesotans will be eligible to be vaccinated sooner, but there's just not enough doses to do that right now. The bottom line, she said, this is a quote from Chris Erzman, that we have a lot more people going to be enthusiastic about the vaccine, but that doesn't necessarily mean that we have more vaccine available. MDH plans to have their priority group, another priority group in early February. They say it might include those who might be 75 years and older, and then 65 and older, plus anyone 14 to 64 who have underlying health conditions. That group of individuals across the state of Minnesota is about 2.2 million individuals. And on average, the federal government is giving Minnesota about 60,000 doses a week. So we have a long ways to go before we reach the general public to get vaccinated. So how the vaccine, how it's distributed and available. The vaccine is allocated according to the number of adults in each state, which doesn't correlate to the number of high-risk people there are. As long as supplies are limited, some states won't get doses proportionate to their needs. And that's even what we're running into our county. One county might receive enough vaccine to get through their 1A priority group. We in Candy County have a lot of people that are made up of that 1A priority group. It's going to take us more weeks and more vaccine than other individuals. So there are discrepancies in terms of where counties and local public health are with getting the vaccine out to the different priority groups. So we are prepared for when a mass amount of vaccine comes to us at local public health or to our community. We have staff that are available. We have sites and locations and plans. We have volunteers, and then we have a lot of community partners that we can also call on for help when we're to a point that we can do more mass vaccination clinics for our public. So I kind of put a little picture on here, Plan A, Plan B, Plan C. Our plans and changes happen continuously. Just this morning, we made plans at 8:15. They've changed now, and it's not even 9. It's not even after 9. So I think what I want to let the public know is we are here, we are ready, but right now we're still working in that 1A priority 3 group. I did pull a little data just as to where things are at with vaccine. This is state data, and then I have our county data. So you can see we've only had 1,496 individuals in our county that have received their first dose of the COVID-19 vaccine. And we've only had 124 people that have completed the second dose, so they're done with the series. Here's just the breakdown of people. You can see a majority of them are between the ages of 18 and 49 getting the vaccine. And that's, again, statewide data. And then in our county, again, we're trending pretty much the same as the state. So we're working together with our local partners, the pharmacy programs and Caris Health, to continue our vaccination efforts in the county. Communication on vaccine availability and updates will be shared. We'll do that through, Caris is doing it through their MyChart program. They would also put any communication on their website. We're using local media, social media. Check out our Facebook page, and then also, like I said, the Caris Health website. The individuals who currently qualify for one of the priority groups, again, frontline healthcare workers, long-term care residents, those are being offered the vaccine, those individuals. And we contact them. So if you're included in one of the priority groups, we will make contact with you. As it becomes available to the public, we will notify the public as to how to register or get signed up for the vaccine. Right now, we don't have a sign up. There's no list to be on. Just be watching out for communications from our office and locally as to when more vaccine is made available.
I have a question.
All right, real quick, because we need to,
Yeah, this will be real quick. I had heard that you were having, at least some people have refused the vaccine. Is there a percentage you have?
You know, I don't have a good percentage just with the vaccines that we've given out, but I know in talking to the hospital system, it's about 85% of the individuals are getting the vaccine.
Thank you.
all right. Quickly.
Quick question, and like you said, it was changing every minute. This virus has the ability to do it to us, and this is such a game changer what we're talking about doing. I'm concerned that we don't have enough vaccine here, and now we heard in the state yesterday that, you know, you can go to St. Cloud, call in, get an appointment, and go get it for population from 65 and up. And we're not even getting close to that yet. So is that going to short us even more vaccine potentially?
So each region is really working hard with the healthcare systems to have the healthcare systems assist public health with finishing out these priority groups. So again, we're in really good communication with Caris Health. They're assisting us. They're taking some clinics and having some people in the third priority group go right to Caris to get those vaccines. But I think the state is trying to have different areas that people can go, so we don't have vaccines sitting. So no, I don't think that that's going to affect the vaccine that we'll get for finishing up this third priority group, no.
Okay, oh, good. Thank you.
Thank you. We do need to cut this off, so we get a little break here between meetings, so I will adjourn the Kennewick County